Hi, I'm Dr. Robert Glatter. I'm a medical advisor for Storelli, and I provide them with advice regarding injury prevention and also injury management. What we're seeing primarily are lower extremity injuries, injuries to the knees and ankles, contusions, also cuts or lacerations, and about 50 to 80% of these injuries involve the lower extremities overall. And with that being said, the rest, about 10 to 20%, are involving the head. This can involve contusions, cuts or lacerations, but also concussions. There should be some realization that it seems that people are all focused on concussions, and head injuries with that, but there's also a fair number of injuries that are not related to the head, and that should be really important that people understand that. So in general, what we're seeing are more head injuries being reported, and the question is, we're reporting them more, but are they actually occurring more? And we have to understand that concussions are not just the result of direct head trauma. They can occur when you have a hit to the body or the neck, and then it's transmitted to the head, affecting the brain ultimately. And these are what we call subconcussive hits. In other words, you don't feel anything. You may not have nausea, dizziness, a headache, any imbalance, but truthfully, you could have sustained an injury and possibly a concussion. Concussions as a subject are very complex, and we don't truthfully have all the answers at this point. And ultimately, we need more research. We need more evaluation of people that suffer concussions and to follow them long term. People that sustain head trauma often can have other things other than a concussion. And it's clear to me, and obviously after being a participant as well as on the sidelines, that a concussion is one possibility, but also head injuries can include lacerations, cuts, bruises, neck injuries. Symptoms of a concussion can be variable. Sometimes nausea, dizziness, headaches, blurred vision. And this doesn't have to start initially. It could happen hours later. And that's important for everyone to know, not just parents, but also older players and professional players. In general, to prevent injuries, it's really important for athletes to focus on mental preparation, but also physical preparation as well. Mentally, we have to prepare, looking at the game plan, making sure we know what we're supposed to do, looking at the playbook, so to speak. But physically, it's important to warm up. Stretching is so key, it's paramount to preventing injury, but also wearing the right equipment and making sure it fits. That's another key part that most people don't necessarily always focus on, because if you're not wearing properly fitted gear, then the risk for injury goes up significantly.